Do you get those days, don't you, where you sort of think everything's a little bit backwards? And for two reasons I'm thinking that today. This story is incredible, right? It is absolutely extraordinary that in the space of 14 years, patient satisfaction with the National Health Service, which, listen, to be clear, they only actually started the records in 1983. But I think that's quite significant because that was just before or right at the beginning of Margaret Thatcher's second term. So you've got the heyday of Margaret Thatcher's premiership. You've got all of Tony Blair's. You've got all of Gordon Brown's. You've got all of David Cameron's. This is where it gets a bit hard to remember, isn't it? You've got all of Theresa May's. And then you've got all of Boris Johnson's. And then you've got all of Liz Truss's, and then you've got all of Rishi Sunak's. There you go, all of Rishi Sunak so far. So, you've got a significant number of prime ministers, albeit that some of them weren't in the job for very long, presiding over the NHS. And in the space of 14 years, it has gone from our satisfaction, your satisfaction, my satisfaction, our confidence in the service has gone from the highest it has ever been in 2010. That was the peak. That was the ceiling, the zenith, to the lowest in the space of 14 years. In the space of 14 years of Tory rule. I mean, it could be a coincidence. Hands up. Hands up if you think it's a coincidence. What? Really? No one? Oh, thank you. Nadine Dorries in the corner. Nadine Dorries thinks it's a complete... Actually, no, she thinks it's Gary Lineker's fault. 14 years, it's gone from the highest it ever was to the lowest it ever was, with only 24% of people saying they were satisfied with the NHS last year in 2023. It was only 29 the previous year, but as I said, a peak of... Guess what? I tell you what, I bet you 50p you don't get... I missed out John Major. No, I didn't miss out John Major. Stop trolling me, Adrian. Seriously. I didn't miss out John Major. I said John Major. Didn't I say John Major? Did I say John Major? Anyway, don't forget John Major. Him as well. What do you think it was in 2010? Go on, have a guess. Say a number out loud, or maybe not out loud if you're, listening to this with a surreptitious earphone in while you're supposed to be, working as an air traffic controller or something. Well, what do you think it was in 2010? So if I tell you that it was 29 for 2022 and it's down to 24 for 2023, what do you think it was in 2010? This is the stuff that I talk to you about every day. You've got other people pouring into your ear the idea that David Cameron would be good for the country, that Boris Johnson would be good for the country, that Brexit would be good for the country, that Liz Truss would be good for the country, that Rishi Sunak would be good for the country, that Jacob Rees-Mogg would be a good Secretary of State for Business, that Mel Stride would be a good Secretary of State for Work and Pensions, that Jonathan Gullis would be a good Deputy Chairman of the... Congratulations, everybody. Can we all just take a moment to congratulate Jonathan Gullis on his elevation to Deputy Chairman of the Conservative Party? I mean, if anybody says Rishi Sunak is brilliant at his job and not desperate at all and a superb spotter of talent, then the elevation of Jonathan Gullis to Deputy Chairman of the Conservative Party is clearly and categorically the proof of that particular pudding. So go on, say enough. David, you're cheating. David, I know that you're cheating because there's no earthly way you'd have got it 100% on the money. You'd have got it like within 5% or 4%, but you're cheating. So stop cheating. You've sent it twice now, David, in Birmingham. You cheat. You cheat face. What do you think it was in 2010? If it's 24% now, how far do you think it's come down? Yeah, 70%. That'd be an A in an exam in old money. I know it's all gone a bit weird now. It'd probably be a 9 or something, or a 7. Don't text me to correct me on the exam grading system. It's gone from 70% to 24% in the space of 14 years. And I genuinely have to do this out loud with my fingers. Hang on. In the space of 14 years and 1, 2, 3, 4, 5 prime... Is it 5 prime ministers? In the space of 14 years and 5 prime ministers, patient satisfaction in the NHS has plummeted from 70% to 24%. And yes, I think I did miss out John Major in my list of all the MPs that had been in charge over that entire period from 1983 to now. But it's the last 5 that matter. Can we take a moment now? Let's have a little think. What have those 5 prime ministers all got in common? Have they got anything in common? David Cameron, Theresa May, Boris Johnson, Liz Truss, Rishi Sunak. Have they got anything in common? Could possibly be, I don't know, I'm seeing the colour blue. Anyone else seeing the colour blue here? I'm seeing a sort of a corrupted blue-hued Union flag cut out in the silhouette of an oak tree. I don't know why. It's coming through to me like that. So that's what's happened, and that's what they've done. Bizarrely, Conservative voters report a marginally higher level of satisfaction with the NHS than Labour supporters do. But I suspect that is an absolutely splendid example of footballification. I suspect there are people, and thankfully I'm not one of them, and I doubt you are, but I suspect there are people who, if their party is in power, will tell a pollster that they're very happy with the NHS or the state of the railways or with any particular public service, because to say that they were very unhappy with it would be, of course, to have to acknowledge the fact that the people in charge are probably responsible for the decline that they're aware of. I also don't know how reliable it is in an objective or in a scientific fashion, because I look at the personal experiences I have, and I really like my GP, for example. I think they're great. It's sometimes, the non-urgent appointments are a little bit far off in the distance, but they're really good at urgent appointments, and I think we're really lucky. I think there's a postcode lottery when it comes to GPs, but we seem to have hit the jackpot. And yet when I look at the online ratings, they're just between 1 and 2 stars, which makes me think the only people that really go online to register a rating of a GP surgery are the people who are very cross, possibly permanently cross, possibly sort of genetically cross. So I don't know whether the same sort of thing happens here. You're more likely to provide a negative answer because things are imperfect than you are to provide a positive. But that, of course, gets undermined by the comparison. That's why the 70% figure is so significant in this conversation. It's gone through the floor. It's plummeted. It's declined at such an extraordinary rate that you'd get whiplash if you'd been watching it in real time. And I don't want to talk to patients, I don't think, today. I may change my mind. I always reserve that right. But I always think that talking about experiences with the NHS is, don't hate me for this, but it's a little bit parking tickets. Do you know what I mean? Everybody's got a story, and they're very rarely give me a ring now and tell me about your bunions. Apart from parking tickets and immigration, the best way to get the phones to ring with absolutely no guarantee of receiving a single interesting call is to say, is there anybody old out there feeling poorly? Your phone lines will ring off the hook. Your switchboard will melt under the pressure of people who feel poorly and self-identify as old. But the likelihood of us hearing anything interesting in those conversations is slim, to say the least. So it's the people in the NHS that I want to talk to today, or the people who've recently left, because I mean, I've got 3 questions, really. The first is pretty obvious. The single most important factor in this decline from your end of the telescope. Now, you might think it's obvious, but I want to get it on my list. 0345 6060 973 is the number you need. The single thing that explains why the service that you slave to provide has been so violently diminished over the last 14 years. We're doing the 2010 to 2024 chapter of the NHS's history, during which period patient satisfaction has plummeted from 70% to 24%. And you, as a nurse, as a doctor, as a paramedic, as an NHS manager, and before anybody applies for Idiot's Corner this morning, the number of NHS managers in our NHS in proportionate terms is considerably lower than in most comparative services and countries. It's very much a right-wing trope that the reason why, so what happens is right-wing politicians come in, skin the NHS, and then their client journalists write articles or present programmes in which they claim that the reason why the NHS isn't doing very well is because there's too many managers. It's so binary and so bovine in its simplicity. It's a miracle anybody fell for it. But hey, this is a country that voted for Brexit. So you as a manager, as a doctor, as a GP, as a nurse, anybody who has worked in or currently works in the NHS during that window from 2010 to 24, what is the single factor you consider to be most responsible for the decline in patient satisfaction, okay? 03456060973. Hit those numbers now. You will go through. It can be political, it can be medical, it can be logistical, it can be mechanical. Mechanical doesn't really fit in that sentence, but I just felt we had a bit of a T.S. Eliot kind of vibe going on with the language, so I threw it in there. That's a question I really want you to answer, all right? Question number 2 is about your job. And this is a bit of a strange question, because I find myself wondering what would happen to the NHS if you all started doing what the railway workers are doing in order to make their grievances land with the public and with the government and with employers. If the NHS started working to rule, what would happen? Do you see what I mean? If you only worked your contracted hours, if you took all of your breaks, if you took all of your leave, if you took all of your holidays, if you left at the minute on the dot that you were supposed to leave, you only ever put in a work when the meter was ticking, when you were working, what would happen? And that, I think, is best answered by the question of how much has your job changed between 2010 and 2024. So the biggest factor in the decline in patient satisfaction from your point of view as a provider of patient care, the biggest change in your job, viewed perhaps through the lens of what would happen if you worked to rule, if you didn't do any overtime, if you didn't do any unpaid work, if you didn't skip any of your breaks when you were on shift. Just have a little think and tell me what would actually happen. 0345 6060973. And then the hardest question perhaps for you to answer, why are you thinking of leaving? There are 2 stories this week. Well, there's one news story this week and one comment piece in the I newspaper, of which I've become a rather big fan in the last couple of years. The news story is about an exodus of nurses out of the UK. As Yasmin Alibi-Brown wrote, you may not have heard this news because such information would disrupt the dark folk tales spun by many politicians and much of the media. You know how it goes. Migrants stealthily arrive, grab benefits and council homes, displace true Britons, abuse girls, worship dubious gods, defile this green and present land. But the number of departing overseas nurses is rising fast. So nurses who have come here from elsewhere to nurse are now leaving. And Yasmin posits the possibility that they are obeying the instruction from countless racists emboldened since 2016 and, of course, represented in the public space by people like Nigel Farage and 30p Lee. These nurses are actually obeying the instruction to go back where they came from. So the question of why are you thinking of leaving the NHS may include racism from the patients and a sense in the society that you inhabit. But of course it may not. So the field is wide open. You can go in on whatever you want on that. Why are you thinking of leaving? And I suppose, where are you thinking of going? So factor, change, leave. If this was a university lecture, what's the single biggest factor that you, as an NHS worker, past or present, as long as you've been on board between 2010 and 2024, what would you point to first to explain why patient satisfaction with the NHS has gone off a cliff? The second is the biggest change in your job. How much has your job changed in that period? And the third follows on from the second. If it has changed so much that you're thinking of leaving, tell me why. 0345 6060 973 is the number you need. Because although patient satisfaction is at an all-time low, I suspect that if somebody polled a little more nuanced on value, respect, reverence even for the NHS, which is imperfect and probably needs to undergo some fairly profound change in the coming years, in the words of Joni Mitchell, you really don't know what you've got till it's gone. Why does it always seem to go that you don't know what you've got till it's gone? And I took some persuading, but looking at that window, that 14-year-long window, looking at those 5 prime ministers, I don't think this has happened by accident anymore. I think this is deliberate. The problem is they're I doubt, competent enough to know exactly what it is they're supposed to be replacing the incredibly popular NHS of 2010 actually with. But let's start with those three questions. Factor, change, lead.